A very good morning to you. I'm Howard Feldman. This is your Sunday Synthesis podcast with me, Howard Feldman, and of course, Dr. Anton Meyberg. It is the 23rd of January, 2022. Can you believe it? And since the last time we spoke, well, I got a little ill and then I got COVID. Luckily, I had a lot of guidance because I watch this podcast every week, every week for the last 2 years, and then every second week, so I knew exactly what to do. Was greatly blessed that we have all this information, that I have been vaccinated, and that in fact it was Omicron that I suffered from. That said, it certainly wasn't a walk in the park, and although everybody does talk about Omicron being a very easy and a non-issue at all, certainly I am feeling the effects and the after effects, which is something that we're going to be talking about as well during the course of this morning's discussion. I'm not sure if we'll be able to submit this to medical aid, but I do intend getting a heck of a lot of advice for myself this morning. Dr. Anton Meyberg, good morning. How are you?
So good morning. So I've got to ask you a very serious question. What's worse, a hypochondriac getting Omicron or gargling a swarm of wasps? It's a tough one. I'm talking about from the doctor's point of view, not from the patient's point of view.
It depends from whose perspective, because for a hypochondriac,
I think this has been the busiest week of my COVID week ever since the beginning of the pandemic. I'm just putting it out there.
Is that why you blocked me?
That's why I blocked you this week, yeah.
All right. Jokes aside, it was a real comfort knowing that we have people like Dr. Anton Meyberg around to be able to guide us through what could be a very anxious and difficult time. How are we looking? How are the numbers?
So currently we're sitting at 349 million cases worldwide with 5.6 million deaths and 278 million cases resolved. The United States has 71 million cases with 888,000 deaths. India has 39 million cases with 489,000 deaths. South Africa is sitting on 3,579,428 cases with 94,063 deaths, 3,049 new cases in the last 24 hours, and 9.2% test positivity rate. Gauteng has 2,476 patients in hospital with 213 in ICU and 91 currently ventilated. And overall, from the Omicron sort of data, we've noticed that this has been a much shorter wave, about approximately up to 75 days. And technically, we've exited this wave, or we're essentially on the tail end of this wave. The test positivity has decreased, it's less than 10%. So we're doing pretty well. And in my own hospital, we're currently sitting on 3 patients in hospital, none of them ventilated.
So that's incredible. Is there a reason that we're seeing these massive numbers in Israel, in the United States, where there are times that it looks like it's almost falling over in terms of the numbers, and yet here in South Africa, we just haven't had that same experience?
Look, there are lots of reasons for it. I think we can start out with the actual environmental types, the fact that we're in the southern hemisphere and we're in summer at the moment and we spend more time outdoors, as well as the fact that so in certain states in the United States of America, there's been a major resurgence of the Delta variant, which is far more virulent than the Omicron variant. That being said, they're now noticing that the numbers of Omicron are going up dramatically in the United States. But the biggest problem they've got there is that the people who are on ventilators and the people that are dying are the unvaccinated. And that's a huge issue, huge issue.
Is Delta completely eradicated from South Africa?
I don't know if we can use the word eradicated. I'm sure it's still floating around a bit, but due to the fact that we had such a high prevalence of infections during the Delta wave and it was so severe, we've definitely got a higher definition of antibody and neutralizing antibodies floating around in our community. They say there's over 70%, which is remarkable and which is huge. So there's definitely a role to play here to say that we've definitely developing, without really calling it, but some type of herd immunity without actually trying to get it, despite not getting the actual amount of vaccinations up to there yet. But our vaccinations are going up. We're sitting on 40% at the moment. So the numbers are going up, albeit slowly, they are going up.
Right. Can we anticipate a fifth wave?
So Prof. Salim Abdul Karim anticipates the next wave in around May. That will be the fifth wave, unless there's another variant that will throw a bit of havoc. Hopefully by May, we'll have a much higher vaccination rate. People have much higher antibodies. And my hope is that by May time, this will be an endemic infection and we'll be able to just carry on as is, like we carry on with flu.
Right. And do you anticipate then as well that we probably, like the flu, will be getting a vaccine every year for this?
That's the common and current thinking at the moment, that this will be a yearly vaccination. Whether or not people choose to do it will be at their own sort of discretion, the same as with the influenza vaccine.
Are they still, I see that, I think it's Austria as being the first country that's pushed for a vaccine mandate. What's your thoughts on that?
So it's a tough one. You got to look at where I'm coming from, seeing what I've seen in my hospitals. And to me, a vaccine mandate makes perfect sense. It's about people's rights, and people have the right to say no, or they don't want to have a vaccine mandate. But it's not about that. It's about people's responsibility to other people. And if you're vaccinated, then your responsibility is that you actually care about people and you want to look after other people. If we look at the numbers in South Africa, there's been about 21 million Pfizer vaccines given, with, they say, about 3,000 adverse effects, whether it's a fever, whether it's muscle pain, that type of, that's been documented, whether it's the thromboses or the myocarditis. 3,000 out of 21 million. With the Johnson & Johnson of 6 million vaccines given, 1,000 adverse effects. So those numbers are staggering. It's minimal. It's minimalistic. So there's no real reason why people can say they don't want to have a vaccine. We know that vaccines actually cut down hospitalization by over 70%, especially in this latest wave.
And then it's interesting to see, because you have really not felt the pressure of this wave during Omicron at the hospital at all.
We haven't had more than one ward open the whole of this wave. It's been unbelievable. It's almost been like, normality back in hospital.
And is that because of a combination of the severity of Omicron as well as the vaccines?
Well, what we've seen with the Omicron is it comes on much quicker and sort of dissipates much quicker. So the symptoms come about within 2 to 3 days, and they resolve within 5 days, generally, with most people, non sort of hypochondriac people.
Hypochondriacs, yeah.
But that's the general rule we're seeing here. And also, the population we're looking at is a young population, a healthy population generally. Our older population, especially those who are in old age homes, are vaccinated. We're dealing with a good cohort of people above the age of 50, above the age of 60, that are looking after themselves, are getting vaccinated. And of course, we know that only about 10% of people test in this country. So we really can't say how many people actually have been infected, but we believe there's been an over 70% antibody response in people due to people having gotten infection throughout the 3 waves.
Very, very interesting. And is spousal irritability part of this Omicron variant, one of the symptoms?
From myself and all the listeners, we wish your wife really tidings. It must be very difficult to have been with you during this time, and we just wish her well. And I think maybe we need to give her the number for Childline. I'm just saying.
Wow. In fact, that's really not what I meant, but never mind. Fine. If you want to choose to misdiagnose, well, that's fine. Be it at your medical peril. Okay, let's talk about some of the questions that we wanted to get to. In terms of vaccinations, we've got a lot of questions around it. What is the latest recommendation? So
we know that there's excellent or very good benefit from Johnson & Johnson plus the booster Johnson & Johnson. But the recent published data in the New England Journal of Medicine goes with what we've been saying for the last few months, that if you've had a Johnson & Johnson, it is far better to get a second shot mRNA vaccine rather than getting a Johnson & Johnson. Not to say there's a problem getting a Johnson & Johnson, but it's almost like the Rolls Royce because it gives you better neutralizing antibodies and T-cell responses. With regards to people who've had their first Pfizer and 6 weeks later having their second Pfizer, a booster is definitely warranted. They say that it's 6 months after the second dose of your Pfizer, or if you're severely immune compromised or you're on immune compromising medication or immune suppressing medication, then 1 month after your second one.
And what happens if you've had COVID in the middle?
So it depends how bad your COVID is, but you kind of can sort of put it in the middle of your whole routine and delay it by 1 month.
By 1 month. Okay,
Yeah.
so if you've
If
had
you're in
COVID,
hospital and severe, you can delay it a little bit longer, but essentially on a safe side, 1 month is safe.
okay, but legally in South Africa, there seems to be a bit of confusion around the mixing and matching. If you've had the Johnson, are you able to go and get the Pfizer?
So that's the big problem. There's no guidelines from SAHPRA to go ahead and give the Pfizer, which is basically taking away, if you want to talk about human rights and everything and our right to make decisions, we're not allowed to make a decision to request a Pfizer vaccine if you've had a Johnson & Johnson, which is completely ludicrous. I mean, especially for medical healthcare workers that have put themselves up front and on the first line, and now they've got to say, hold on, we're not prepared to do the trials, so rather just have the Johnson & Johnson or rather just have the Pfizer, rather have what we call a homologous vaccine, which is the same vaccine, but don't have a mix and match because it's too much work from our side. And I think it's ludicrous.
Absolutely bizarre. It really makes absolutely no sense. And is there any discussion around it that it's going to change?
Well, at the moment, no. There's no discussion, and no one's entered into talks with SAHPRA about it. So we haven't heard any rumblings about it.
A few people asking, where are we in terms of kids?
So kids still above the age of 12 are vaccinated, but there's nothing been said between kids 5 to 11 years old. And the problem, and I don't know if it is a problem, I'm going to say it in inverted commas, the problem we've got now is because we're at the tail end and because we're doing so well, people are going to be more reticent to vaccinate their 5-year-olds now. So if we went back sort of 2 months ago, people would say, yes, I'm definitely vaccinating them. But now when things are quiet, they aren't going to be so keen. But it makes a difference because there's no sort of guidelines from or no sort of ruling from the health professions to say that we should be vaccinating them. But we know all over the world they are vaccinating the 5-year-olds and up.
Yeah, I mean, we were even considering having another child just so we could vaccinate them. Of course, so. Then once we got COVID here, no one wants to see each other again. So that's kind of off the table for now. But so be it. Either way, we in this country still are lagging a little bit behind in terms of kids. Let's just talk for a minute about long COVID, because there's a lot of discussion around it. As a hypochondriac, I mean, I'm 2 weeks in. Is it too early to diagnose myself with long COVID, do you think?
I have no idea what you just diagnosed yourself with. You've probably got many medical maladies, but unfortunately for you, it is too early to diagnose long COVID. So when we talk about long COVID, we talk what we call PACS, which is post-acute COVID syndrome. Generally, it's symptoms that develop 8 to 12 weeks after having COVID. So if you've had it within 2 weeks, it's too early to call it long COVID. It's sort of resultant of the COVID that you experience, and that will take a while to settle down. But we're talking now longer term, 8 to 12 weeks, and the symptoms can generally last 2 to 3 months after that or even longer. Wow. And it's due to an ongoing inflammatory state, post-infective state after having had SARS-CoV-2. And there are lots of side effects or there are lots of consequences of having this long COVID, whether they're neuropsychiatric, which could be during acute phases, could be confusion, stroke, neuromuscular disorders, or the long-term ones, which could be respiratory with a cough, with shortness of breath, with lung fibrosis, as we said, neurocognitive, confusion, gastrointestinal, musculoskeletal, and most importantly, fatigue. And interestingly enough, a study came out this week speaking about the brain fog. A lot of people complain of brain fog during their acute COVID, and they're not entirely sure of the mechanism of why and how it develops. But a recent study in a small cohort of people was done, and they believe that what happens is the SARS-CoV-2 actually infects your cerebral spinal fluid and causes inflammation in that, and that's why you get this brain fog, and that's why you can't remember recent events, and that's why you struggle to name things or name people, and you can't stay focused, and you're slow at processing things. But that essentially dies out or gets better as the inflammation recedes and goes along. So long COVID is a thing. I mean, whether it's the headaches, it's fatigue, and all over the world, and even in the Western Cape, they're opening up long COVID centers to treat people, because this is something we're going to be dealing with for a long time. I mean, we see a lot of patients in our rooms now that are trying to deal with long COVID as well. So it's a reality, and it's a new disease we're dealing with, but it's something to be taken seriously.
In general, how do you treat it? I mean, do you treat it just symptomatically?
You've got to treat it symptomatically. Yeah. Look, one of the best things for long COVID especially if you haven't had it, is a booster at the right time. They've shown that people who've had their booster vaccines or the other vaccines definitely get better quicker from the long COVID point of view.
That is absolutely fascinating. And I've also heard, and I don't know if I've heard about it more with Omicron, but it's certainly something that's come about anecdotally, is I'm hearing people say, oh, I had a post-COVID pneumonia, post-COVID respiratory infection. Is that unique to Omicron, or was that something that was happening anyway? And what is that?
I think what we've seen with Omicron is it's less about respiratory infections. It's almost like people have developed some type of antibodies throughout the time, and it doesn't almost pass through the nasopharyngeal area and go down into the lungs. So I think people are just immune suppressed and the immunity is down. And yes, they can get sick afterwards, whether it's a bacterial infection or something that develops afterwards, but it's not the main feature of the Omicron that we've seen in this country.
That's fascinating. It's such an interesting thing because we've been doing this for 2 years, and there's always this shift and observations around how this virus is working.
Yeah, I've said many a time that the more we know about this virus, the less we actually know, and we learn every single day. And in 2 or 3 years' time, we'll only start unraveling the real secrets of it. Hopefully.
Yeah. In terms of people getting back to normal life after COVID, exercise, just normal routine, what do you recommend generally?
So we recommend that you've got to listen to your body. I think that's the most important fact out there. You know, there's no hard, fast guidelines say do this, do that. But essentially, give yourself 2 weeks after you've had COVID just to settle down and take it slow. And then slowly you can start getting back into it. I mean, if you're an athlete like you, then you've got to basically give yourself that 2 week period and slowly start building up your heart rate. At first, build it up to 30% of what its potential is. Then after a week, build up to 40, 50%, and slowly build it up.
Okay, never mind. Yeah.
Slowly build it up accordingly and take it slow and don't overdo it. You know, the biggest worry we've got with COVID and the vaccines is once again the myocarditis. So you cannot overdo it in the first 2 or 3 weeks post having an infection, because you still can develop arrhythmias, which is abnormal heart rhythms, palpitations, or heart abnormalities due to this virus.
And in terms of the vaccine, you recommend for how long should people not exercise after the booster?
Look, the guidelines are, especially for males 18 to 47 years old, that you shouldn't exercise about a week. I'd say, why be silly? Just don't exercise for a week, whether you're male or female. Have your vaccine. Just take it easy for 5 to 7 days afterwards. Don't put your body under stress. It's more prominent with the Pfizer, with the mRNA vaccines, as with the Johnson & Johnson, but it's not worth the risk. You don't know what it's like to get a severe myocarditis until you've seen one, and it's not worth just risking those 5 to 7 days.
Let's talk about mask mandates, because I see that the UK is now talking about no more masking. What's your feeling around this?
So the UK have basically dumped the masks, essentially, and one can only wonder where that's coming from. If it's a political thing, you know, if Boris is trying to, you know, curry favor again with his voters. But that being said, it's a line we're going to have to go down, and it's a line we're going to have to cross, because that's the reality where we're going. We've always said that masks are going to fall away, but it just has to be at the right time. And if we look at masks, they're our line of defense against this virus. There's no doubt about it, but only if they're worn properly. And one of the biggest problems we've got in this country is A, people don't wear them properly, and B, people wear these material masks which don't do anything. So unless you're wearing a surgical mask, or ideally, you know, an N95 mask, you're not getting the full protection. But that being said, you're not going to go driving in a car without a seatbelt, you know, so, you know, not to prevent an accident. You know, you've got to take care and you've got to have the precautions. My feeling is that we're getting to a stage now we can start relaxing the rules. So one would hope that the government's going to come out with a ruling saying, you know, if you've been vaccinated and you're outdoors and you socially distance, you don't need masks. That's ideal. That's where I believe we're at the moment. But unfortunately, the rule is, and the law is, you have to wear a mask when you're outdoors. But we're definitely going in the direction of masks becoming less of a thing, especially in the state we're at. And if there's a resurgence, then we can boost the mask wearing again to that effect. But it's going to take a while to sort of get people's turnaround on this to say that actually it's okay not to wear masks. But as I say, we can't do anything until we get the go-ahead from the government. That's the law.
To some extent, government is perhaps being a little dangerous with this, because if people decide on their own that they don't need to wear masks, then we become non-law abiding. Whereas if they say, right, it's safe enough, drop the masks outside if you social distance, we learn to trust the system. And then when they say, listen,
100%.
we're back again, unfortunately, you've got to mask up, we then mask up. But if you have...
they've almost sort of dropped the whole ball here, because, you know, while we're still in a state of disaster or state of emergency, we shouldn't be. There's no reason for that now. You know, things are getting back to normal. Drop those restrictions. You know, as far as I understand, that hopefully in the next week or two, they're going to reformulate the isolation quarantine laws again. Most scientists are calling for an 8-day sort of isolation period if you're affected. The UK, the CDC are doing a 5-day isolation, or especially the CDC are doing a 5-day. If you've got no symptoms thereafter, then you can come out still wearing a mask. And I think, you know, let's not kid, you know, people don't test. And what we're seeing now is that people are actually not wanting to test for fear that if they're positive,
100%.
They won't be allowed to go to certain places like schools and all other events. So they've got to get in line with what's happening in this country. And what's happening in this country, we're doing well. We really are doing pretty well at the moment. You know, as I say, the infection rate is less than 10%. We're on a good wicket. You know, it's time for us to now go with the flow and actually start following the actual right way of doing things, so that we can promote health and promote people doing the right thing. And as you correctly say, that when things do get bad, if they do get bad, then when they say put masks back on, that, then we'll follow those rules. But if we carry on like this, no one's going to listen.
Well, I can tell you from our experience that my daughter starting matric, I had to go into quarantine then. It was a very difficult decision to make, because part of me wanted to say, listen, don't test, keep away from people, and carry on our lives, because we weren't that severe. And had I not, you know.
So did you just say you weren't that severe? I heard that coming from
my wife wasn't severe. She was severe in her reaction to a lot of stuff.
Family counseling later.
Okay,
fine. That's a good point you're making. And I think that's a very important thing, so that if they do change the rules with asymptomatic people, they won't have to quarantine, which is a very thing. They have to wear their masks and they have to social distance, but they won't have to quarantine. I mean, even in Israel now, you know, they're talking about with school children, they're doing away with the mandatory quarantine if you've been exposed to somebody, and what they're saying is they'll let them do rapid tests at home, and if they're negative, then go back to school. So even Israel are starting to become less pedantic as we're going down the line, and they're hoping to institute that in the next few days in Israel. So we've got to go with the flow. Have to get it going in the right direction now.
Hazel asks this for one of her friends. She says, my son tested positive for COVID on his PCR test when he was looking to come back to South Africa. He went into quarantine, he retested, and on day 5, he was still positive but had no symptoms. How long is he going to test positive? How does he travel like this?
Yeah, you see, it's a problem, because you can test positive for 2 to 6 weeks afterwards. Generally, they say that after day 10, you're not infectious anymore. But we also know if they're going to, in America, they've decreased the rules. That's the CDC says you only need 5 days of quarantine, and you shouldn't test after. But if you're traveling overseas, it becomes a problem. So if it's after more than 10 days and the child is still testing positive, they're going to have to get in touch with the Ports Authority and get letters from doctors there and here to say that it's okay to travel overseas, that the patient's non-infectious despite having a positive result.
Yeah, because these are, you know, this does seem to be a thing that you can linger in terms of
the test result can linger despite you not being infectious anymore.
Right. Okay. Just looking at some of the other questions. Mark says a close relative has a neurological disorder called Myocentenia Gravis. Can you pronounce that for me?
So Myocentenia Gravis, which is an autoimmune disease where basically the nerves and the muscles don't coordinate well together, essentially. It's a muscle weakness, essentially, neurologically invoked.
Okay, and he says she had a mild COVID, Omicron in November or December. Are there any long-term effects that can have effect on MG?
So we know that, myasthenia gravis is considered one of those conditions where you are immune suppressed, and it can linger with patients who have got myasthenia gravis because they're on immune suppressant drugs. So whether they're on drugs like prednisone or azathioprine or methotrexate or any of the other drugs, these things can interfere with your antibody production, especially if you're vaccinated. And you've got to time it correctly with regards to when you have your vaccine, with regards to when you have your medication. And that you need to speak to a rheumatologist, neurologist, etc., about to discuss what the actual best timing is for that. It can linger with anybody, not definitively with myasthenia gravis. You've just got to watch for the symptoms.
All right. I'm presuming from everything that you're saying that in a nutshell, you're saying adhere to the rules at this stage, but we hope that government is going to start relaxing rules so that we can start living a much more normal life. Is that
that's exactly what I'm saying.
of what you're saying?
That's exactly what I'm saying. I'm saying we have to follow the rules. The rules are the rules. Whether we like them or not at the moment, well, what can we do? But the rules are there, and we really are hoping that, when the minister speaks again on Friday, he'll change the rules. Whether we're speaking about the quarantine or the mask or that type of thing, we've got to change him. We have to move forward.
And I'm presuming there's good news given your T-shirt.
There's always good news. There's always good news, okay? We have essentially exited the fourth wave. We're in the tail end of the fourth wave. And in inverted commas, it's been a good wave compared to the last three waves. The mortality rate is far decreased. The hospitalization rate is far decreased. So we've done well. Hopefully, as we just discussed now, the isolation and quarantine ruling will be changed dramatically in the next week or so. And our feeling is we can definitely relax measures according to government ruling, but it's time to do that. And more importantly, what a great team getting through to the Caraba Cup final this week with class act from Jota. What a boykie. That's our man. And to quote, insisting on your rights without acknowledging your responsibility is not freedom, it's adolescence. Have a good week, be well, be safe, and let's get going forward.
Absolutely fantastic. Dr. Anton Meyberg, thank you. As always, great news and a very informative podcast as always. If you do want to be alerted as to when we record these, don't forget to subscribe below. But in any event, we'll be back with you in 2 weeks' time. In the meantime, keep sending your questions, keep safe, keep responsible, and God bless.